Joining us right now to weigh in, Republican Congressman Sean Duffy of Wisconsin. Good to see you, Congressman. Thanks so much for joining us.
Good morning, Maria.
What about that? Even Kevin McCarthy yesterday agreed, yeah, maybe we are losing the messaging war. Even if you have the fundamental story right, if you're not communicating it well to your constituents and the public at large, it doesn't matter, right?
So to take the truth of what Democrats are saying aside, because it's absolutely false, it's Republicans' responsibility to get out and message this bill. And I've expressed that frustration to everyone in our leadership team that you need a rapid response team. Democrats and liberals continue to put out false stories about what we're doing on health care. We need to have rapid responses addressing, on a day-by-day basis, the falsehoods of what they say. And that's not happening. And if you're going to win the vote, not just in the House but in the Senate, you got to win the debate. And that happens in the media, and you need everyone empowered to go out there and fight it. And I got to tell you, it's not happening right now. I would agree with you.
Congressman, tell us then, what is it that you're fighting for? The line from Republicans has always been repeal of Obamacare. So what do you want to create in its place?
So first off, we have to acknowledge what's happening right now. Democrats are saying people are going to die, and they want to send Republicans their ashes, and they're having die-ins. The bottom line is Obamacare is imploding. Unless you're subsidized in an exchange by the government, you can't afford this health care. Again, Minnesota, a 50% increase. Arizona, 100%. They doubled the cost of their premiums in 1 year. Iowa, 94 of 99 counties are not going to have any providers in their counties. So as this thing collapses, it's our job to step in and go, how do you make markets actually work in healthcare? And we're trying to bring more choice and competition, more market principles into healthcare that we think will reduce costs. And as you've heard on this show, there's 3 phases to this. This bill that we passed in the House is phase 1. Tom Price's work on reg reform is phase 2. And we're going to have to come back with a bill that's going to need Democrat buy-in, that brings us competition across state lines, that gives us tort reform. And we're going to need Democrats to help us on that phase 3. But this is a 3-phase process. And again, I think this can save health care.
Congressman, it seems like one of the big failures has been that you federalize an issue, which was the problem of Obamacare, and you have a one-size-fits-all for all 50 states, rural, urban, everything. Couldn't the Republicans look at this and say, instead of trying to create a federal program, we're going to road test various ideas? Take 10 states for an idea, 10 states. They voluntarily take a piece of this. They find out what works, and you decentralize the control and the whole aspect of health care delivery. Wouldn't that be a more Republican idea than still having it where it's based in Washington and where somebody's got to figure out how to make it work in urban Boston the same way as they would in rural Arkansas?
First, hey, Governor, it's great to be on with you. As you know, I'm a huge fan, and you always make so much sense, and this is a great point. So we do have the opt-out provision in this bill that gives states the autonomy and the authority to set up health care the way they see fit, which, to your point, is the right way to do health care. Instead of having the bureaucrats centralized in Washington making decisions for us, if we can give control back to our states, but really then give control back to people, because, as you know, the bureaucrat in Washington doesn't know the risk that I face in my life or the risk that I have with my family. Let me pick a plan that works for the risks in my life. So, Governor, I have 8 kids with my wife, Rachel. You might think that it's pretty smart that Duffy's buy maternity coverage. But if you have a 58-year-old couple, they might go, well, you know what, that's probably not a risk that we face in our life. Let's let people pick plans that fit their risk, and when you do that, you're able to bring prices down. Not only that, if we can help people, which we're going to, with pre-existing conditions, and if you get the government to step in and help remove them from the pools because they're helping them with their premiums, then that's not driving up your costs, Governor, because you're paying for someone with pre-existing conditions. Like in Wisconsin, we had a high-risk pool that not only the state subsidized, but now with this health care bill that we passed in the House, the federal government would help subsidize their premiums, but you, Governor, won't. And I think that helps everybody in dropping premiums.
So